Here we have MRI of the knee in 20-year-old with history of football injury not able to wait where the plain radiograph was unremarkable. Here what I want to show is how a pivot shift bone contusion looks like, and once we see it we will never forget. The pivot shift bone injury is seen as ill-defined abnormal bone marrow signal in the mid-lateral aspect of the lateral femoral condyle and posterolateral aspect of the lateral tibial condyle. And to some extent, we do find ill-defined abnormal bone marrow signal in the posterior aspect of the medial tibial condyle. If we find abnormal bone marrow signal in the mid-lateral aspect of the lateral femoral condyle and posterior aspect of the lateral tibial condyle, the pattern is very typical of a pivot shift bone contusion. In addition to that, we find a small smooth depression in the mid-lateral aspect of the lateral femoral condyle in pivot shift contusions. In pivot shift contusions, most of the time the ACL is completely torn, as we see here, and this is associated with medial or lateral or both meniscal tears. In this case, there is none. They are also associated with MCL injury. Here we can see abnormal bone marrow, abnormal signal on both sides of the MCL, and on the axial we can see there is partial tear in the anterosuperior aspect of the MCL. Hence, it is a grade 2 injury. We need to also look carefully for any posterolateral corner injury. We need to look in the most lateral aspect on the sagittal sequence where we see the Playboy bunny appears intact. We can also look here on the coronal sequence where the LCL appears intact, and we need to scroll the axial sequences to make sure the LCL is intact. When we are scrolling, we need to make sure the biceps is intact, the popliteus tendon is intact, the arcuate ligaments are intact. Here there is grade 1 edema of the popliteus muscle with uh, increased fluid between the popliteus and the tibia, suggestive of uh, changes secondary to contusion. There is also moderate joint effusion. So in summary, here I wanted to show a typical appearance of pivot shift bone contusion and ACL tear.